Hello, everyone. Kristen Choi, a psychiatric nurse and assistant professor at UCLA School of Nursing, a young woman who wrote a first-person account on her experience volunteering in Pfizer's clinical trial. After the second injection, she experienced a combination of symptomatology that is rare and that she thinks people should be aware of in the sense that it is a good sign. Now I get to talk to her. Kristen, thank you so much for being with us and for all the work that you are doing.
Thank you for having me on.
First of all, you don't really know right now if you have received the real vaccine or the placebo, but you think that it was the actual vaccine, right? Why do you think that? What happened after that second injection?
Sure. So at the time I wrote the article, I didn't know whether I had received the active vaccine or the placebo. However, I have since confirmed that I did receive the active vaccine, which was very good news to receive. At the time I wrote the article, though, I didn't know. It was a blinded study, which meant the participants in the study, as well as the researchers, didn't know whether people received the placebo or the active vaccine. And even though I didn't know at the time, I thought that I received the vaccine because I had a very strong reaction after the second dose. I developed chills, a fever, a headache, muscle pain, joint pain, nausea, and all of those things are classic signals of a vaccine reaction. And so when I saw all of those signs together, it signaled to me that I had probably gotten the active vaccine, and that turned out to be correct.
So some people are going to feel fatigue, have a headache, get chills,
Yes.
muscle pain, fever. For some, they're all or will feel like similarities with the diseases symptoms. How do you respond to people saying or fearing, and let me put it simply, that they're going to get COVID if they get vaccinated?
Sure. Those concerns are understandable. We know that these vaccines have been developed quite quickly, which is surprising for a lot of us to see. The important thing for people to know, though, is that these vaccines absolutely cannot cause COVID. They are not made with coronavirus, and there's no biological way for them to lead to infection. What I would also tell people is that if they experience any of the reactions that I did, it's important to understand why that reaction is happening. When we get a vaccine, the way that it works is by activating our body's immune system, and that teaches our body how to fight the virus. As our body is learning that process, that's when we might start to have some of the signals of being sick. Again, things like chills, a fever, muscle pain, headache, etc. And I think it's important for people to reframe that as these are not something to worry about, but rather a signal that the vaccine is working and that our body is learning how to protect itself. And that is a good thing rather than a bad thing.
Even if we get the vaccine, should we believe we are free and clear and we won't be expected to wear a mask or keep distances? What's your opinion on that?
Sure. So there is a lot about the vaccines that we don't know yet, even though we do know that they are very safe and very effective. If you get the vaccine, you can expect to have very good protection from getting serious COVID-19 disease, but we don't yet know if you can still spread the virus. And that's still something that scientists are studying. So at this time, to be safe and to protect the people around us, it's very important that everyone continue to wear masks and social distance, even after getting the vaccine, until we know more about how the virus is spread after getting the vaccine. And that's still being studied right now.
Let me ask you something more personal. You wrote that you participated as a volunteer at the vaccine trial because it felt like an honorable thing. Is this the way people should think about their participation in the real vaccination process? I mean, that it would be an honorable thing to do, not just for themselves, but for their countries, the communities that they live in.
I think so. I think it's really important for people to know that getting a vaccine is not just about protecting you. When all of us take a vaccine, it protects the people around us, and it especially protects those who can't get the vaccine. We know right now that children cannot get the vaccine. We don't know yet much about pregnant women and other special populations. And so if you are a healthy person who's able to get it, and you are playing a role in helping to protect your family and community. And so, yes, absolutely. I do think it's an honorable thing for all of us to do, and something we all have a responsibility to do if we can to help slow down this pandemic.
Now, nurses in some parts of California protest over the pandemic working conditions, and they want safer, staffing ratios. Do you want to tell us why is this happening and how the surge is affecting nurses despite the rollout of the vaccine?
Sure. So in California, our coronavirus situation is very grim. We have just out of control numbers of cases and deaths, and that unfortunately spills over to our hospitals and ICUs being flooded with COVID patients. It creates very, very difficult working conditions for doctors and nurses when they have so many patients to take care of. In regards to the nurse protests, I think what's important for people to know is that the very first job of a nurse is to protect our patients. And when we have to work in unsafe conditions or conditions where each nurse has many, many more patients than they should, it increases the risk that patients will die. And so the nurse protests that are going on are really a signal that nurses are worried about our patients and they want to make sure that the conditions are safe so that we can take care of all of you and make sure that we give you all the very best care we can. And so I hope that we will see more resources, more doctors and nurses being brought in to help respond to the pandemic in California, because again, the hospitals are very full and it makes it very difficult for us to do our job. It's really every doctor or nurse's worst nightmare to be in a scenario where you are watching people die or suffer when, you know, you could have saved them on any other day if there hadn't just been so many of them. And we really want to try to prevent that situation for all of us.
I see. Now, as a psychiatric nurse and assistant professor at UCLA, you're researching how the COVID-19 pandemic is affecting mental health. You have said something very worrying, that for some people, this pandemic was their first ever encounter with mental health. What are the primary reasons, according to your study, for which people attempted to commit suicide, and what can be done, Kristen, to deal with the issue?
So we know that the pandemic has led to a lot of mental health concerns for both children and adults. In California, we're seeing a lot of increased demand for mental health services. Back in the spring, a lot of people missed appointments. And so now in the fall and winter, we're seeing the result of that missed care in terms of a lot more people are feeling depressed, isolated, sad, and struggling. And that does play out in things as severe as suicide attempts in some cases. And so it's very important that as we address this pandemic, that we take care to look out for the mental health side of things and make sure that there are resources for people who are struggling with the pandemic conditions.
Thank you very much, Kristen Choi, for sharing your experience with all of us. It's absolutely inspiring.
Thank you for having me.
That's all for us, ladies and gentlemen. Have a nice rest of the day.